Right now, somewhere inside your abdomen, a cluster of cells smaller than a grape is quietly deciding how the rest of your day is going to go, and it has been doing this job for decades without once asking for a thank you. Here is the part almost nobody tells you. That cluster of cells can be failing right now, gradually, silently, with absolutely nothing that feels like a symptom. And the very first sign most people over 50 ever get is a diagnosis they did not see coming. No chest pain, no dramatic collapse, just silence, right up until it is not silent anymore. Before we go further, I want to ask you to do something small for me, and I promise it takes less than 30 seconds. If the information in this video helps you even a little, consider joining this community by tapping that subscribe button. This channel exists because people like you decided this kind of straight talk was worth sticking around for, and every person who joins helps me know which topics to go deeper on next, which directly shapes what I make for you. It genuinely helps, and it takes almost no effort on your end. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working with patients just like you, men and women over 50, who are trying to protect their health before something goes seriously wrong. I did not become the kind of doctor who waits for a crisis. I became the kind who tries to get to you before the crisis has a chance to start, and pancreatic health is one of the clearest examples of why that timing matters so much. Let me ask you something before we go any further. Think about your energy after a big meal lately. Has there been a stretch of the afternoon where you feel unusually tired, almost like your body wants to shut down for a while, even though you did not do anything physically demanding? I am not asking to scare you. I am asking because that specific kind of afternoon heaviness is one of the only external clues your body gives you when the organ we are talking about today is starting to struggle, and most people write it off as simply getting older. The organ I am talking about is your pancreas, and I want to be honest with you. Most of what people think they know about it is incomplete. Your pancreas sits behind your stomach, and it has two main jobs. It produces digestive enzymes that break down the food you eat, and it produces insulin, the hormone responsible for moving sugar out of your bloodstream and into your cells, where it can actually be used for energy. The cells that make insulin are called beta cells, and you have roughly 1 million tiny clusters of them scattered through your pancreas, each one working continuously every time you eat anything at all. Here is the part that changes how most people think about this organ forever. Beta cells do not fail all at once. They fail the way a light bulb slowly dims before it finally goes out, except this dimming can take 10, 15, even 20 years. And during almost all of that time, you feel completely normal. Your energy might dip slightly, your afternoons might feel heavier than they used to, but there is no alarm bell, no dedicated nerve ending screaming that something is wrong. Your pancreas simply does not have a way to tell you it is struggling until it has already lost a significant portion of its capacity. I want you to picture your beta cells the way you would picture a small kitchen staff trying to cook dinner for an entire restaurant during a holiday rush that never actually ends. In your 20s and 30s, that kitchen staff can keep up fine, even with extra tables seated. But every extra pound carried for decades, every meal loaded with refined sugar and processed carbohydrate, every stretch of poor sleep adds another table to that dining room. The kitchen staff does not walk out and quit. They just work harder and harder, quietly, until eventually they cannot keep pace with the orders coming in. And that is the moment blood sugar starts climbing in ways a lab test can finally catch. Now here is where I need to correct something almost everyone over 50 believes, because it is one of the most common misunderstandings I hear in my own practice. Most people believe that if their energy is fine, their digestion is fine, and they do not feel sick, their pancreas must be functioning well. That feels logical. It is also not true. Beta cell function can decline by 40% or more before most people notice any consistent symptom pattern at all, because the remaining beta cells simply work harder to compensate, the same overworked kitchen staff pulling double shifts to keep the tickets moving. Feeling fine is not evidence of a healthy pancreas. It is often evidence of a pancreas that is compensating, and compensation has a limit. I want you to do something with me right now, something you can actually check in real time. Press 2 fingers gently just below your ribs on the left side, roughly where your bottom rib meets your body. That general area sits close to where your pancreas lives. You will not feel the organ itself, and mild tenderness there usually means nothing serious, but I want you to notice something else while your hand is there. Think back honestly. Has that region ever felt subtly uncomfortable after an unusually large or unusually sweet meal, a kind of dull fullness that lingers longer than it should? If the answer is yes, file that thought away, because we are going to come back to exactly why that happens. Now let me walk you through what you can actually do about this, because I did not bring you this far just to leave you worried. There is a specific drink, one of the cheapest things you can possibly buy, that early clinical research has linked to measurable improvements in insulin sensitivity markers when used consistently. I am talking about bay leaf tea, made from the same dried bay leaves that have probably been sitting in your spice cabinet for years without you ever once considering drinking them. Here is why this particular leaf keeps showing up in research on blood sugar. Bay leaves contain a group of natural compounds, including certain polyphenols, that appear to help cells respond more efficiently to the insulin your pancreas is already producing. Think of insulin as a key and the receptors on your cells as locks. Over years of high sugar intake, those locks can become slightly rusted, requiring more and more key turns, meaning more and more insulin, just to open the same door. Some of the compounds in bay leaves appear to help clean out that rust a little, which means your existing beta cells do not have to work quite as hard to get the same amount of sugar out of your bloodstream. A small clinical trial involving people with elevated blood sugar found that regular bay leaf intake was associated with meaningful improvements in insulin sensitivity markers over a period of weeks. And while I want to be honest with you that this research is still considered early and would benefit from larger studies, it lines up with what many physicians who treat this population have observed anecdotally as well. I promised you we would come back to that dull fullness under your ribs after a heavy meal, and here is the connection. That sensation is very often nothing more than your pancreas working overtime, pushing out extra insulin and extra digestive enzymes at the same time, the equivalent of that kitchen staff sprinting between 2 stations at once. It is usually not dangerous in an isolated moment. But if it happens consistently, meal after meal, year after year, it is one of the only physical signals you get that the workload on that organ has been climbing quietly in the background. Let me tell you about a patient I will call Richard, 63 years old, a retired high school shop teacher who came into my office because his wife had noticed he was falling asleep in his recliner almost every single afternoon, sometimes for an hour or more. Something he had never done before retirement. Richard himself was not particularly worried. He felt normal in the mornings, his digestion seemed fine, and he assumed the afternoon exhaustion was simply what retirement felt like after decades of an active job. His fasting blood sugar test told a different story, sitting well into the range we consider pre-diabetic, a number that had almost certainly been climbing for years without a single obvious symptom along the way. Richard was not lazy. He was not imagining anything. His beta cells had quietly been losing ground for a long time, and his body's only real signal was that heavy afternoon fog he had written off as simply getting older. Here is something I do not say lightly, because I know how it sounds coming from inside the healthcare system itself, but it is true, and it deserves to be said plainly. There is no billing code for a cup of bay leaf tea. There is no procedure reimbursement for teaching a patient how to protect beta cell function before it declines. The system we have built is remarkably good at treating a diagnosis once it exists, and remarkably underfunded at preventing that diagnosis from happening in the first place, simply because prevention does not generate the kind of ongoing appointments and interventions that keep a system financially sustainable. I am not asking you to be angry about that. I am asking you to understand why so much of what protects you quietly, cheaply, and early never makes it into a typical 15-minute appointment. I want you to sit with that for a second, because it changes something important. And then I want to ask you something. How old are you right now, today, watching this? I am not asking out of curiosity alone. Your age changes what I would actually recommend for your specific situation, whether the priority is early prevention or active reversal of existing insulin resistance, and it also directly shapes what topics I choose to cover next on this channel, because I am building this content around exactly who is watching it. Here is something that might surprise you. The global cost of untreated and undertreated blood sugar disorders now runs into the hundreds of billions of dollars every single year in healthcare spending alone. And yet, the single highest impact intervention most people could take costs less than a cup of coffee and takes about 5 minutes a day to prepare. That gap between how expensive the problem is and how cheap the most effective early tool actually is not an accident of nature. It is simply that cheap, unpatentable interventions rarely get marketing budgets, while expensive interventions almost always do. Let us talk about what the second suspense point I mentioned earlier actually means for you directly, because I do not want to leave any myth standing unexamined. The myth, again, is that feeling normal proves your pancreas is fine. The reality, now that you understand beta cell compensation, is that feeling normal only proves your remaining beta cells are still winning the fight today. It says nothing about tomorrow or next year or 5 years from now if the underlying workload never changes. That is precisely why waiting for a symptom before acting is one of the most common and most costly mistakes I see in patients well into their 60s and 70s. So here is the 7-day protocol, and I want to walk you through it clearly enough that you could start it literally tonight. Take 2 to 3 dried bay leaves and steep them in roughly 1 cup of freshly boiled water for 10 to 15 minutes. Covered, then strain and drink it once daily, ideally in the morning before your largest meal of the day. Continue this every single day for 7 consecutive days without skipping, because the insulin sensitivity benefits researchers have observed appear to build with consistency rather than a single use. I need to be completely honest with you about something that happens around day 4 or 5 for a lot of people who try this, because it is the exact moment most people quietly give up without realizing what they are giving up. Around that point, many people report their afternoon energy dip becoming noticeably less severe, and here is the trap. That improvement feels like the finish line, so the tea gets forgotten the moment life gets busy again. It is not the finish line. It is proof the mechanism is working, and the moment you feel that improvement is precisely the moment consistency matters most, because beta cells that are finally getting some relief need sustained support, not a single good week followed by a return to the old pattern. That heaviness we talked about earlier, that sudden lift you might feel by day 5 or 6, that is genuinely one of the more emotional moments in this whole process, because it is the first real evidence your body gives you that something inside is shifting in your favor. Hold on to that feeling and let it become the reason you keep going rather than the reason you stop. If what you just heard landed the way I think it did, please take 15 seconds right now and share this video with someone in your life who is over 50, because there is a real chance this is the piece of information that gets between them and a diagnosis they never saw coming. And if you have not yet joined this community, now is genuinely the moment, because the topics I cover next are shaped directly by the people who decide to stick around. Before we get to the full 7-day action plan, I want to ask you one more thing. And I would genuinely love to hear from you in the comments below. Has anyone in your life ever gone through an unexpected blood sugar diagnosis that seemed to appear out of nowhere? And what is one topic related to your own health that you would want me to cover in a future video? I read every single comment, and honestly, some of my best video ideas have come directly from what you tell me down there. Now, let me give you the complete 7-day action plan, step by step, so you can start tonight with zero confusion. Number 1, prepare and drink 1 cup of bay leaf tea every morning for 7 consecutive days, using 2 to 3 dried leaves steeped for 10 to 15 minutes in freshly boiled water. Number 2, if you are currently taking any medication for diabetes or blood sugar management, talk to your doctor before starting this protocol, because certain compounds in bay leaves can interact with blood sugar lowering medications and may require a dosage adjustment. The third step is to eat your largest meal of the day earlier rather than later, ideally before 3 in the afternoon, since your body's insulin sensitivity is naturally higher earlier in the day. The fourth step is a 10-minute walk taken within 30 minutes of finishing any meal larger than a light snack, because movement immediately after eating helps muscle tissue absorb glucose without requiring as much insulin from your pancreas. The fifth step is tracking your afternoon energy honestly in a simple notebook, rating it from 1 to 10 each day, so you have real evidence of whether this is helping rather than relying on memory alone. The sixth step is reducing added sugar in your morning beverages specifically, since a sugar-heavy start to the day places the highest single demand on your beta cells before they have had any rest at all. And the seventh step, once your 7 days are complete, is deciding with clear eyes whether to continue the tea as a long-term daily habit, because the research supporting it points towards sustained use rather than a single short course. I want to thank you genuinely for spending this time with me today. Videos like this only reach the people who need them because people like you decide this community is worth being part of. So if you have not already, please consider joining us here, and I promise to keep bringing you the kind of information that should have been common knowledge decades ago. Before you go, I want to say clearly that this video is for educational purposes and is not a substitute for a real conversation with your own doctor, especially if you are managing diabetes, taking blood sugar medication, or dealing with any existing kidney or liver condition, since bay leaf compounds are processed through both organs. Please talk to your physician before starting any new protocol, not because I doubt you, but because your specific health history deserves a plan built just for you, and I would rather you be careful than sorry. Take care of that quiet, hard-working organ of yours, and I will see you in the next one.